So we talked about the structure of the synovial joint. Now we're going to talk about factors that influence the stability. So this is really important. One of the things that we talked about were ligaments, and we talked a little bit about hypermobility. So ligaments can determine how stable a joint is. But there's actually three major reasons or factors that influence the stability. So the first one is the shape of the articulating surfaces. So we talked about ball and socket joints when we were talking about the humerus and the hip joint. And you'll remember that the ball sits into a socket. And that socket could either be a shallow socket, as in the shoulder, or it could be a deeper socket, as in the hip. So when we talk about the shape, it can actually also be affected by the presence of cartilaginous discs. Like in the knee, we'll talk about the menisci that actually change that shape of the articulation. But even within the shoulder, we have a cartilaginous fibrocartilage that actually helps to increase the depth at which the head of the humerus fits into the shoulder, or into the articulates with the scapula. So let's look at this articulation. So this shows the glenoid cavity. This shows hyaline cartilage because it is a synovial joint. But associated with the glenoid cavity is a lip of tissue, which is called the glenoid labrum. And the glenoid labrum functions to increase the depth of articulation, and it makes the joint more stable. The other factors that influence joint stability are the ligaments. So we have ligaments. So the number of ligaments, and then maybe overall, like how stretchy they are, right? But the number of ligaments is an important one. So we see that there are some ligaments that attach the humerus to the scapula. In the hip, there's a lot of ligaments that attach the head of the femur into that articulating surface, which we talked about is the acetabulum. The third thing that affects the stability is the muscle tone. So like how contracted the muscle is, that have tendons that extend over the joint. So the muscle tone of muscles with tendons extending over the joint. When we get to talk about the knee, this is one factor where muscle tone plays quite a big role. And so if you have instability in your knees, oftentimes you might go to physical therapy, and what they will do is they will make you work out your quads. And the reason for that is the quadricep muscle has a tendon that extends over the knee joint. And so if I'm working out my quads, I'm going to increase the muscle tone, the relative length of my muscle, and it's going to pull those back together so that the joint stays more stable. So these are the three factors that you need to describe, and you need to, we're going to talk about them in depth as we talk about each of the joints. So let's just look at the shoulder joint once more. So we have this is articular capsule, but we have some ligaments, the glenohumeral ligaments that attach the glenoid cavity to the humerus. And then what is this? This is the tendon of the long head of the biceps brachii. So your biceps muscle, right, would maybe help to stabilize your shoulder. We also have the tendon of the subscapularis muscle. That's actually a rotator cuff muscle that helps to stabilize your shoulder joints. We did talk about the rotator cuff muscles on the back of your scapula, that come around and have tendons that attach to the humerus that helps to stabilize your shoulder joint. So the shoulder is actually a joint that is less stable than some other joints, and it is actually a joint that can become dislocated. And so dislocation refers to moving the head out of the bones are not aligned properly. And so then we actually have to put them back into proper alignments in order for the joints to work. Like you, once you, if you're, you would know if your shoulder joint is been dislocated, because one, it'd be painful, but two, it just won't work right? It won't feel right. And so that all of these things can be seen in this particular diagram that references the shoulder joint.